After this video, you will be able to recognize commonly tested EEG patterns and know high-yield facts to answer questions on sleep stages correctly. We are first going to talk about the awake states, which have both beta and alpha waves, and you have to know the difference between these. So for beta waves, these are going to occur when the patient is awake and their eyes are open. These waves are going to have the highest frequency and the lowest amplitude. It's also going to show desynchronized activity on the EEG. Alpha waves also occur while the person is awake, but their eyes are closed. This can have an 8 to 13 hertz, and it is synchronized activity. It's important to note that the transition to sleep in one begins when the alpha waves disappear. You might have heard of the acronym BATS drink blood, and the beta and alpha waves are the first part of the BATS. So beta, busy brain, open eyes. Alpha, relaxing, closed eyes. Once the alpha waves disappear, you're going to go into stage N1 sleep. This is light sleep and theta waves. So when you're looking at an EEG in N1, you're going to see the theta waves, which are 4 to 7 hertz. They are slower in frequency than the alpha waves. This is the lightest sleep. It accounts for about 5% of total sleep time, so not much. And this stage is the transition from wakefulness. Eye movement is going to be slow, rolling eye movements. And it's important to note that the patients are easily arousable during this stage, and this is when people can get hypnagogic hallucinations. This is also when you get that falling sensation when you're falling asleep. This is the T part of the BATS. Now we will transition into stage N2 of sleep. This is when you will see sleep spindles and K complexes. I personally think these are the easiest to recognize on the EEG. The sleep spindles are these high frequency bursts, and the K complexes have a high amplitude. These are going to look like bursts of diamond throughout the EEG. This is also the longest stage of sleep. It accounts for 45 to 55% total time of sleep. You also might get asked, when does bruxism occur? Bruxism occurs in stage N2. This is also when memory consolidation occurs. So these are all high-yield things that you need to know about stage N2 of sleep. If you see these spindles or K complexes, just click stage 2, stage N3 of sleep. This is incredibly high yield because there's so many things that examiners can ask you about stage N3. This is when deep sleep occurs, delta waves, and when parasomnias occur. The EEG will show these 0.5 to 2 hertz delta waves. These are lowest in frequency and highest in amplitude. This predominates the first third of the night, so think third 3. And this is when restorative sleep occurs. Again, the deepest sleep, the hardest to arouse, and it's important to note, this is when growth hormone is released. You might get asked on that. This is when parasomnias occur. So this is when people sleepwalk, when people get night terrors, and when bedwetting occurs. These all can be asked on exams. So remember, D for delta waves, deep sleep, and disorders. Alcohol and benzos can actually decrease N3. That's why when someone drinks alcohol or they use benzos, the sleep is not as restorative. But because night terrors occur during N3, it actually can be a treatment, the benzodiazepines, not the alcohol, for night terrors. Next, we will talk about REM sleep, which is also super high yield. This is when rapid eye movement and atonia occur. So on the EEG, you're going to see sawtooth waves. These are going to be beta waves. They look like the brain is awake, and this is paradoxical sleep. The atonia, you're going to see a loss of motor tone, paralysis, which prevents you from acting out your dreams. This is when nightmares happen. And this is super high yield for exams because they might ask you when someone's having a nightmare, what stage of sleep is it? It's REM sleep. If they're acting out a night terror, then that's N3. You need to know the difference between night terrors and nightmares. The neurotransmitters involved are also super high yield, especially for the PRITE exam. Acetylcholine rises during REM sleep. However, norepinephrine, 5-HT, and histamine all fall during REM sleep. This is also incredibly high yield for both PRITE and USMLE. Depression increases total REM sleep, but it decreases REM latency, so you dream sooner. Again, like if in 3, REM sleep is also decreased if you are using benzos, alcohol, or barbiturates. So they are going to make the quality of sleep worse. You need to know these incredibly high-yield clinical pearls for the exam. Narcolepsy will always show up on the USMLE and the PRITE. You need to know that this is disordered regulation due to loss of orexin. Orexin comes from the lateral hypothalamus. Remember that it will show up on the exam. Narcolepsy has the tetrad of excessive sleepiness, cataplexy, sleep paralysis, and hallucinations. And by hallucinations, I mean the hypnagogic, which is when you're going to sleep, and hypnopopnic, which is when you are getting up. You need to know what those mean for the PRITE because you might be asked on it. The treatment is modafinil, which is first line, and sodium oxybate, which is for cataplexy. These are high-yield facts that you need to remember about architecture. So the N3, the deep sleep, predominates in the first 1/3, again 3 for 3. REM predominates in the last 1/3 of the night. In elderly patients, this is important for the PRITE. Decrease N3 sleep, decrease REM sleep, increased latency, and increased awakenings. So we're decreasing the quality of sleep, increasing latency, and increasing awakening. So think about the early bird elderly patients. In depression, also high yield, decrease REM latency, so REM starts too early, and increase REM density, decrease N3 sleep. You will have to go over that a few times in order to remember it, but it will show up on your exam. Important pharmacology to know: GABA agonists, alcohol, benzos, barbiturates. These decrease N3 and REM sleep. This will frequently show up. Clinical use: benzodiazepines are useful for night terrors and sleepwalking because they suppress N3 where these occur. Caution with benzodiazepine: this can precipitate confusion and falls in elderly, so they're pretty scary to use in elderly patients. I included a high-yield summary with the batch strength blood acronym so that you can cram right before your exam. If you found this helpful, I have more high-yield videos on this playlist, and you can subscribe for new videos every week. Good luck on your exam.